after turning 60, most seniors will start to experience losing their muscle mass at a rate of 1 to 2% every year. Along with that muscle mass loss often comes the loss of strength, which is the biggest reason that people lose their independence as they age. This is called sarcopenia. The good news though is that this is not inevitable. Not only can you prevent this, but also reverse it. First step is to incorporate some form of resistance training. Now, if you're not used to going to the gym to lifting heavy weights, that's not a big deal. If you're just starting out, you can start with some body weight exercises that you can do right in the safety of your own home and then progress from there. But that is the important point. As you start out, you're gonna notice some improvements. You might start getting some muscle mass just from doing the activity. But if you want to continue and stay healthy, you need to be able to progress those exercises. So as an example, we'll go through a few exercises right here, which include sit to stands, just rising and slowly lowering yourself down to a chair. Heel raises, as in or calf raises, raising up onto your toes. Standing marches, and also some side and back kicks, which you can use resistance bands if you have that available to you. Now, progressing these, ways you can do that is by adding more reps, increasing your range of motion, or adding weight if you have that available to you. But you need to be significantly challenging yourself during these exercises in order to continue to see progress and get the outcome that you want. Now that we've given our body the stimulus to grow muscle by lifting, we need to give it the building blocks to actually accomplish that. So we're going to step 2, making sure that you eat enough protein. So you might have seen some different suggestions in terms of how much protein to get during the day. In terms of making sure that you're able to build muscle, especially as you get up there in age, you want to be eating between 0.7 grams up to 1 gram per pound of body weight. And the conversion to kilograms is over here if you're looking for that. Now, what that means is you're going to be taking a lot of protein in during the day. You can get different sources, which include Greek yogurt, chicken, beef, eggs, etc. The typical things that you would think about having a lot of protein. One way to make it easier though is to just supplement with some form of whey protein or vegan protein, even collagen protein. Any of it works, whatever agrees with your stomach, but it's an easy way for one shake to get an extra 30 grams of protein in per day and accomplish that goal. This is gonna set your body up so that you're actually able to get the muscle that you worked hard for by lifting. Step number 3 is just increasing your general activity throughout the day, typically measured by step count, which you can get by using a pedometer or a watch that tracks your steps like this. There's a few different options out there. You can look at them. Pedometers go for as low as $1 to $20. Some watches are more expensive, but it's what you want to do, as long as you're accomplishing that goal of increasing your step count. They see that people can start benefiting from increasing their steps from only doing 2,500 steps a day, and every 1,000 steps you add during the day. So if you go from 2,500 to 3,500, you're decreasing your chance of dying by any cause, based on research, by 15%. That is huge. And it goes down another 15% again when you go to 4,500 steps. And it increases even past 10,000 steps a day. So the more steps you're doing, chances are the better your health outcomes are gonna be, the more that you're gonna be able to improve your metabolism, your joint health, by just keeping that lubrication of the joints and the blood circulating, keeping things healthy, which will facilitate the results you get from lifting. Finally, step number 4 is to recover like it's your job, primarily through getting enough sleep. Even as we age, we still need about 7 to 9 hours per night of sleep in order to get the best recovery possible, especially as we're increasing our activity through lifting and walking more throughout the day. Your body's gonna want it. Good news is those might make you sufficiently tired to help you get that more extra bit of sleep. But I know there's some common problems that people start to deal with as they get older, including like frequent bathroom trips that might disturb your sleep or limit it. So my suggestions are, before you go to bed, try the best you can to stop drinking any fluids about 2 hours before you go to sleep. Same goes for eating, about 2 to 3 hours. Stop eating before you go to sleep. That would be ideal. Other tips include trying to keep the room as dark as possible, either through using an eye mask or blackout curtains. Keeping a cool room around 67 degrees Fahrenheit is typically what they see to be ideal. If you run cold, you might raise it up a little bit. If you run hot, you could probably even go lower. Whatever is most comfortable for you. And the last 2 tips include, If you can't fall asleep and you're just laying in bed, try to get out of bed so you don't associate being awake while you're laying down in your bed. You want to be able to just hit the pillow and be able to fall asleep. So you don't want to associate being awake with the area that you're falling asleep. Go to a different room, try reading a book, something relaxing to get you back in that headspace where, okay, I can fall asleep. And then one more thing that might help would be some type of calming routine, like meditation before bed, taking 5 to 10 minutes to work on your breathing, which you can find some free guided meditations on YouTube or an app like the Calm app to help you with that process. Hope this helps. My name is Connor Ganzer. I'm a doctor of physical therapy. If you have any questions, comment them down below. Please like and subscribe, and thanks for watching.